All right, welcome to another edition of the Franklin Community High School Career Exploration Project. Today I am joined by an Indiana Violent Death Reporting System epidemiologist, Morgan Sprecher.
Sprecher.
Is it
Sprecher.
Sprecher?
Yep.
Are you sure?
I'm pretty sure.
Okay, Morgan Sprecher. I'll take your word for it, I guess. Morgan, I'm sorry. Morgan, thank you so much for joining me.
Yeah, thanks for having me.
All right, so Indiana Violent Death Reporting System epidemiologist. That is a mouthful. Why don't you help clear it up for me? What do you do?
Yeah, so we'll start with the root word. The career in epidemiology is a study of epidemics. So whether that be what I do, injury prevention, or any sort of other epidemics, like I'm sure COVID, that's more infectious disease. We also have chronic disease epidemiology, such as diabetes or cancer, anything like that. So specifically with my job, the Indiana Violent Death Reporting System is a grant that we got from the CDC, or the Centers of Disease Control and Prevention.
We've heard of that a little bit recently.
Yeah. So we got that one actually pretty recently in Indiana. It was 2015. And essentially what it allowed us to do was collect from vital records here any suicides, homicides, or overdose deaths in Indiana. So those death certificates will go to vital records, and on a monthly basis, I get those reports. And then the cool feature of INBDRS, for short, it's easier to say that than the mouthful, is I then contact the coroners and the law enforcement that worked on those reports that were there at the scene, and read through those. And we input into a system with the CDC that we share anything that happened during that death. And what's really cool about it is we can look at any like mental health circumstances or life stressors that were going on at the time of the death. So as the epidemiologist, what I kind of look out for is trends, because a large part of what we talked about with epidemics is you're trying to prevent this stuff from happening. So I'll look and see maybe over the past 3 months, I've started to see high school suicide rates increase. And then that's when I can dig in deeper and see, okay, why is this happening? So then I look and I see, oh, a lot of them are starting to have family problems in the home. So then we can start to reach out to the different communities that we're seeing arise in this and say, hey, here's some family resources that you guys could use. What we've been seeing a lot lately too with our older adult males is a rise in overdoses due to financial problems, actually. So then what I do as well is I work with different banks or anything like that to provide them suicide prevention resources or overdose prevention resources. So it's really about trying to find those niches and target prevention efforts and where can you catch these before they're happening. Because unlike infectious disease, like, yes, it's great to see where people are getting sick from so you can prevent it from spreading. But with injury prevention, specifically what I do, it's life and death.
Right.
Like, how can you keep people from dying? So that is the job in a nutshell. Obviously, there's nitty gritty. I work a lot with our governor's office here. I'm sure you've seen Governor Holcomb a lot lately with COVID response, but anything with the school systems, any suicide prevention trainings that you guys do at the schools is all set up from the data that I've given to them, so that they can provide it to you guys. So it's kind of like a streamline effect. So that's what they call it a lot of times, is upstream prevention, because it starts with the data that I get and that I'm seeing around the state.
Gotcha. So you're the QPR person.
Yeah.
I'm a QPR
certified.
Oh yeah,
you're an instructor. That's awesome.
Yeah. Now this, the job, it's got a lot going on there.
Mm-hmm.
And is this your first job? Is this your first job out of school?
So yeah, hired full-time. This is my first job. Before I'd had internships with the Indiana Department of Health. But those were also infectious related. So I was working with West Nile disease. But while I was in grad school, I don't know if you want me to talk about my education and training now. So I had my undergraduate degree in biology. I knew in high school that I loved my science and math classes, but didn't know exactly what I wanted to do with it. And then about my junior year in undergrad, I was looking at different careers and saw a master's degree in public health because I knew I had some lab experience while I was at Purdue and didn't like the isolating feeling. I love being with people and reaching communities and not necessarily being in the lab. So I knew that wasn't for me. And a lot of times too, I thought that was kind of a bummer that like, oh, this isn't what I do. Everybody feels like they know what they want to do, but it's almost better. And I think because you're like, okay, that didn't work out for me. I know that's not what I want to do. So I'm going to try this instead. Not, I found this, I love it, and this is the only thing I'm going to do. So I thought it was helpful to kind of test different areas to see what I liked and didn't like. But sorry, going back, my junior year, I looked into Masters of Public Health. And in public health, you can actually do multiple different concentrations. So epidemiology is just one concentration of that. You can also do social and behavioral sciences. So that's more like aspects with family. So a lot of like DCS people have their masters in public health. You can do environmental public health, policy. So epidemiology kind of encompasses all of that because you can see I'm making these changes in policies to give to you guys, but I'm also using the data aspect of it, but then I'm also reaching out to people using the social aspect of it. So it just kind of encompassed everything that I really liked about math and science at the same time. So then I applied for my master's in public health, got in, and then it's a 2-year program. And I was starting to take, I knew I wanted epidemiology, obviously. So I'm starting to take concentrated classes in epidemiology. So infectious epidemiology, chronic, and I got to injury prevention. And I didn't really understand what it would be like to be in injury prevention. And then we started talking about how like even wearing seatbelts is because of somebody who had their master's in public health. And just little stuff like that, that truly is a difference. Like I talked about between life and death and preventing injuries, that I was like, this is actually pretty cool. And I've always just also been really into like CSI and all those different kinds of shows. And so it kind of feels like that sometimes. I feel like a little investigator. So for me, it's really up my alley a lot, seeing that different stuff. But I hope I answered the question.
No, yeah, definitely.
Okay.
So it's kind of a combination of your love for science, a little bit of statistics with the math, and psychology in reality.
Mm-hmm.
Kind of getting to see how people tick. Has psychology always been something that you've liked?
It's always been interesting to me, but I've never like did like a minor in it at Purdue or anything like that. But a large majority of this is like mental health. I work with a lot of mental health organizations around here. American Foundation for Suicide Prevention, Mental Health America of Indiana. We aren't really what we call siloed into our own expertise. We kind of blend everything together. So if I see on my reports that, hey, I'm starting to see that after talking with the coroner, talking with the family, they have been diagnosed with depression or whatever, I can talk to this other organization. Have you seen a rise in depression in this age group or whatever it may be? So it is interesting that you're never really alone in this kind of job. You're always kind of working outside your own entity.
Mm-hmm. I gotcha. So we talked about, your love for science, your love for math and stuff that kind of led you to this career. Now, I want to give you a chance to say this. Where did you go to undergrad, and where did you get your master's?
Are you tricking me?
No, I'm not tricking. I want to give you, I know your love, and I want to give you an opportunity to give them another shout out.
Oh, well, I did my undergraduate degree at Purdue University in West Lafayette.
Yeah.
And then I did my master's degree, and
higher education, right?
Yes, I switched it up and I went to Indiana University in Indianapolis. So I've got my dual degrees hanging next to each other, actually, at home.
You obviously you're a big boiler, so we had to let you give them a shout out.
That was nice.
Now with this career, obviously you love it, you enjoy it. So speak to some of the pros, some of the things you like the most. And no matter what job it is, there are some negatives, there are some cons. What are some cons to you about the job?
I would say, because I am very big in math and science, the cons for me would be that like writing and literary side of my brain, I'm not strengthened in. So to get this funding for what I'm doing, I have to write grants. And sometimes for me, that can be pretty brutal because I'm not used to writing 12, 20 page papers. Like that's just not something I'm suited in. So it's taken a while for me in practice to learn how to write eloquently, I guess, and use that skill. I'm so used to, as an epi, you're pointing out just like quick, hard facts. So it's easy for me to be like, oh, 72% of males die by suicide due to gun violence or something. Like that's easy for me to do, but to write it out and talk about why it's happening and the long detailed explanations of that is not best for me. So I said that was probably one of the cons, is some of the report writing you have to do and with the grant applications and doing all of that. The pros, not even necessarily for this job, you just have to be passionate with what you're doing. Like even this morning we had like a 3-hour meeting and it went like that for me because we were talking about what I am hired to do. And I love, like we talked about, listening to those murder podcasts or watching those shows or something. So if I'm enveloped in that and then I'm doing it for work and I'm getting paid to do it, it just seems like I'm doing something that I do at home anyways.
Now, your job, it has to be, I would imagine it would be kind of probably mentally taxing a lot of times.
Yeah.
How do you take care of your mental health? And just as someone kind of more as a professional in this role, how would you advise someone who's in kind of a high stress situation to do mental health?
Yeah. So, I mean, everyone's going to be different in how you handle stressful situations. For me, I know that I have to think of these, I have to be desensitized to it and think of these as just numbers and not actual people. There have been a couple of times, that I've seen someone I know and I'm like, oh my gosh, I can see everything that happened. So that's kind of shocking. So then sometimes I have to walk away from the situation, maybe go on a walk, get a coffee break or something. And I just know that's what works for me, is kind of removing myself and thinking that these are numbers, this is a job. I know that some of the other people that we have here that do look at some of the reports do other things. Like they have a book that they read when they need to take a step back or anything like that. So everyone's going to be different. You just have to know what works for you.
Okay. Now, as far as personality goes, what type of person do you think would be a good fit for epidemiologists, or even, not even specifically your sector of it, but just in general? And what type of person you're like, yeah, that wouldn't work very well?
Oh gosh. So you will be doing a lot of statistics, not necessarily hard statistics, but a lot of rates and percentage calculations, looking at large data sets and like mining the data and cleaning it up and stuff like that. So anybody in that sort of realm would be great at this. I wouldn't say you necessarily even have to be type A, because I've had people tell me before they've met some epidemiologists that are shy and just want to do this. And everyone else here is like, we never expected you to be an epidemiologist. You're so outgoing. You look at the most depressing stuff. Like, how are you still bubbly and doing what you do? And I think that's just the kind of person I am. Like, you have to realize that, like I talked about, they're just numbers. You can't think of them as anything else other than that. So if you're not into numbers, probably wouldn't be the best. What else? I don't know. You honestly kind of do have to be not outgoing, but personable. You have to have that strong communication skills, because you're the one that has all the data, no matter what it is, if you're in my position or if you're in a different position, and you're the one that's going to need to tell the public what's happening. Think about, like with COVID, all the infectious disease numbers that are coming out. You have to relay it to the public that they can understand it. So strong communication skills is really important, and you have to be able to make those contacts with other people to build those relationships and keep those relationships.
Yeah.
Does that help?
Yep. Yeah. And then I would assume, I mean, there's some speaking, there's some public speaking that you have to do. So
yeah, that too. So like just the other day, I don't even know sometimes if I'm going out to the public to do a presentation. I work with our naloxone program manager. So Narcan helps someone come out of an overdose. So since I'm seeing those overdose deaths, I'll come with our program manager to these forums where people in the public will learn how to administer that. And I kind of talk about with what I see from the toxicology reports that we get from somebody that's overdosed, looking at any overdose trends, stuff like that. But yeah, as of like last week, we went somewhere and I had no idea that 3 news stations were going to be there until I showed up. And I'm like, I'm glad I washed my hair this morning. So yeah, it's stuff like that. It's when you feel confident in what you know, it doesn't, and I feel like I've kept repeating this, it doesn't feel like you're doing a job. It portrays when you're talking about something that you know and that you love, you can see that rather than being like, oh, this number says this.
right.
And that just also kind of goes with how long you've been in a position and stuff like that. If I heard that when I started the first month, I'd be like, I have no idea what I'm doing. But yeah, you get used to it.
Yeah. Now, let's say a person is in high school and they want to go into a career in epidemiology. How would you suggest they start preparing for that?
Yeah, so a lot of times too, also with public health, like I know there were some people in my master's program that their undergrad degree wasn't even anything remotely scientific. It wasn't in biology or chemistry, or some universities, I know IU specifically has an undergrad program for public health. There were some people that were pre-law or pre something else, not scientific. So it just, whatever you think you would need to do. So for me, I knew I wanted to be in science related field, and I just happened to find public health while I was in undergrad. But if you know for sure you want to start in that, I would say start with the science and the math classes. And even like you talked about the psychology, sociology, because you're working with people, public health is about the public. It's different than, like a doctor's office and you're with patients one-on-one. It's all about the population and the population as a whole. So you are monitoring this entire group of people, not just one person. If that makes sense.
Yeah. Yeah. Okay. Last question here. And this is a tricky one because I didn't put it on the paper. And I also, for every single person I've interviewed so far, except for the very first one, I've told them about this and I totally spaced telling you this question. So high school Morgan, if you could go back and talk to high school Morgan or just give general advice to a high school student, what would it be? And see, this is why I tell people.
I got it.
Oh, wow. Go ahead.
Your life is not going to go as planned. I was straight A. I don't think I've ever gotten lower than an A- on a report card before in high school. I go to Purdue and I actually started in pharmacy. Very first class, my parents are going to watch this. They're going to be so mad at me. My first semester I take, failed a class. Complete F, not even like a C or a D, F, completely failed. And I remember crying and like, I don't even know who I am anymore. I've never failed anything before in my life. So just a complete shock. And that's when I kind of, you have to get your big girl pants on and you're like, okay, this is real life now. Like, what am I going to do? I switched to biology because I still knew I liked the science and the math and everything like that. And so then I started the next semester taking those classes and I was like, okay, wow, I'm glad that happened because this is absolutely what I want to do. I'm so much better at this. Started getting A's again.
Yeah.
And just time after time like that, I started to realize, applying for internships and different clubs or organizations that I'm doing, going through something as silly as like sorority recruitment. Stuff that I always pictured is not going to be what you think it is. but it's going to work out, and it's going to be how you handle the situation, that how your outcome is going to be.
Yeah.
But man, that was a rude awakening.
Now, do your parents know?
Oh yeah.
Well, I was gonna say
they do know, but
that'd be great if they were just finding out now. I'd be like, I don't know.
Also, like, why did you switch?
Yeah. What's
don't like it anymore?
Hey, you know what? I'm assuming, I don't know, just guessing your parents' names, maybe Steve and Stacy. Is that right?
Maybe.
Oh man, you turned out okay. So I guess besides.
Yeah, see, exactly. Like, that's what I'm saying. Like, I didn't even know public health existed until I was a year and a half from graduating. So technically, then I kept my major because I found out you didn't have to change your major to public health. So I was like, oh, okay, perfect.
So when you were a senior in high school and someone would say you're going to be an epidemiologist,
I'd be like, what's that?
Might have been like, I don't like skin.
Yes. I would say I need to Google this because what the heck is it? But yeah, and that's why like when I was in high school, I was thinking I have to do something that's going to make me a lot of money and something that people know. And I wish I would have had something like this for someone to be like, oh, this is a not non-traditional, but what am I trying to say?
It's an outside of the box. It's kind of like when you think of, because I always say when someone once says they want to be a doctor, you think when you go into the medical field, there's like doctors and nurses and that's it. And then there's really so many
physicians assistants and
there's so many other things. So but I mean, it's just the way that you roll with it, like and understanding that life's not always going to go the way you planned for it. And now you're
with the punches.
Employee, so
so then, especially with COVID, when that first came and we were getting the whispers about it, it was, okay, you're an injury prevention epidemiologist, but I've had all that schooling beforehand that I got pulled in right away, to help with the response and looking at, okay, we're going to do contact tracing to see how many people is this infecting. Epidemiologists are the people saying, oh, we're finding out that it does take 10 to 14 days for an incubation period. And that's why I feel like people sometimes get frustrated as well. It's because like things keep changing. They're telling us lies, but really like this is such a novel thing to happen that we're learning about it the same time everybody else is. So it's super interesting, and it's never going to be an exact science either. So yeah, it's an ever-changing field, that's for sure. So it's so funny too, because I keep saying, wow, like we've talked about in class all the time about like the Spanish flu and everything and how that happened in the early 1900s. And then here I am within the first 5 years of my career, and I'm already seeing a pandemic. I'm like, wow, I'm going to be great for later. I can handle anything now.
When it dies down or whenever, when we kind of get the hang of everything.
I know. It's so funny because we'll always joke. We'll be like, oh, well, next pandemic, we'll know what to do.
You'll be like, yeah, retire. That's what I'm going to do the next one.
For sure.
All right. So once again, Morgan Sprecher, thank you so much for joining me here today. I appreciate your time.
And we also do, sorry, this is a shameless plug now. We do have 3 internships.
Is this for you or is this for Purdue? Because
for me.
Okay.
We have 3 internships available within the Division of Trauma and Injury Prevention every spring semester, summer semester, and fall semester. So you just have to go on the Department of Health website, or you can even just Google Indiana Department of Health internships. There's other ones within the agency as well, but 3 specifically within trauma and injury. If anything interests you, you can also Google my name and my email will pop up. I don't know if you're going to have my contact.
If they're watching this, then they can contact me.
Okay.
I can get them your information.
So yeah, and even if you don't want to intern here, if you just have questions or anything specifically related to like the application process for graduate schools or anything, I'm happy to help.
Awesome. Well, thank you again. Morgan Sprecher, Indiana Violent Death Reporting System Epidemiologist here on the FCHS Career Exploration Project.